Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights. Governor Fintiri of Adamawa State announces plans to establish a world-class sample collection center in order to reduce COVID-19 infections in the state. Governor of Benin State goes tough against violators of COVID-19 non-pharmaceutical interventions. And Israeli government announces stricter measures against COVID-19 spread. We begin in Europe, which has recorded over 5 million coronavirus infections since the first cases appeared in China in December. Reports say that more than 380,000 new cases have been reported in the past week, the highest number in the region since the start of the pandemic. It shows that a total of over 5,421 cases have now been registered, 5,421 cases, of which more than half were in Russia, followed by Spain, France in third place, and the United Kingdom in fourth place. Europe has recorded over 200,000 deaths. The rise in infections can be partly explained by the sharp increase in testing in countries including France, where more than 1 million tests are now carried out every week. Despite the increase, many less serious or asymptomatic cases probably remain undetected. Now from Europe to Africa, where cases are at over 1.4 million confirmed, with more than 1.1 million recoveries and 34,000 deaths cumulatively. The region is recovering at 82%, and this has been stable for the last couple of months. However, 5 countries represent 70% of the continent's total caseloads. First is South Africa, with about 47%, Egypt in second place, 7%, Morocco with over 100,000 cases as well. Ethiopia has over 70,000 cases at 5%, and Nigeria at 4%. According to the Africa Centers for Disease Control and Prevention, 5 countries are reporting highest number of new cases between September 17 to the 23rd, and these countries are Morocco, South Africa, Libya, Tunisia, and Ethiopia. But the trends for the Africa region in the last 1 month shows different ranges by regions. For example, Central Africa, which reports its numbers in batches, saw a 56% increase, followed by North Africa, 14% increase. However, a decrease in the number of coronavirus cases is maintained in East Africa at 15%, Southern Africa 11%, and West Africa 14%. The Africa Centers for Disease Control says the message behind the figures is that the public health measures track, test, treat, the triage and the community engagement are working. Well, let's come to Nigeria, where the NCDC reported 111 new cases of COVID-19, bringing the total number of confirmed cases to 57,724. Last night, the NCDC noted that the new cases were reported from 12 states of the Federation, including Lagos, where 31 cases were recorded, and several other states, as you can see on your screen. The NCDC report shows that 48,985 recovered patients have been discharged, and over 1,000 deaths have been recorded so far. Now, since the coronavirus took the world by storm, corporate entities, business owners and individuals have been counting their losses. The president of the Pharmaceutical Society of Nigeria, Mr. Sam Ohabunwa, says the losses in the sector since the first outbreak have been over 5 billion naira. And though things are gradually opening up, recovery is slow.
China was closed, India was closed, then traffic, logistics, air transportation. As I speak to you, it's not resolved yet because some people are starting and going back, closing and locking down, locking up and locking off. So there's lack. There are supply gaps in the market, and that's because there were these disruptions. So companies couldn't produce. They didn't have raw materials because of the lockdown and the issue of no traffic. logistics. And some countries decided they weren't going to even allow you import anything. India put out a list that they will not sell their APIs because what we import is mostly pharmaceutical active ingredients for manufacturing. They say they won't import. So even if, and now I'm sure they're just getting back to it until they restore their own domestic supply. So we lost a minimum, I've done their calculation, a minimum of 5 billion in lost sales opportunity.
Let's take you to Nasarawa State, where our correspondent Halima Gayam brings us this update on school resumption preparations.
While some states in the Federation have reopened schools, Nasarawa State is still prepping in that regard as a date of resumption is yet to be decided. The government say it is taking it one step at a time, making sure that all safety requirements are provided so it doesn't jeopardize the health of pupils.
We are reviewing the situation and also comparing notes with other states so that we could identify areas that we could improve upon and to see what we can provide before we reach a conclusion regarding the date for reopening of the schools.
Governor Abdullahi Sule, who awaits recommendations from key players, will waste no time to get the ball rolling.
We have to monitor this kind of thing so that we don't expose the students, into additional danger. And as you know, locally for us, in Nasarawa State, we are one of the few states that are lucky to have a deputy governor, who is also a medical doctor, who is heading that committee, that is monitoring this. So they are monitoring it. And as a governor, I will wait to hear from the professionals. If they believe very strongly that it is time to reopen the schools, I'm also in a hurry to reopen the schools so that students can go back to school.
The Nasarawa State government is heeding to the caution of the Presidential Task Force on COVID-19, which has warned strongly that 10% of treated cases in the country are below 19 years. Halima Gayam for COVID-19 updates.
Thank you, Halima. The disregard for COVID-19 protocols outlined by the Nigeria Center for Disease Control, particularly the non-pharmaceutical measures, is a worry for the Benin State government. A visit to the capital shows some views that the coronavirus is still an elitist virus. Here's our correspondent, Pius Angbo, with more.
The World Health Organization has recommended the use of face masks as one of the non-pharmaceutical measures to combat the spread of COVID-19. However, in Benin State, population here think that it is not true that we have COVID-19. Some of them whom I spoke with believe that COVID-19 is a sickness for the rich.
As me like this, as poor man like this, I know they travel outside. So coronavirus will come where I did. I know they sleep inside AC. My their motor they get AC. Understand? But where they sleep and now heat throughout. Okada assist on, even they hit me. And so I know say they will wear face masks. To say that they wear face masks is not even the first preventing measure to me. Because man, the money we are even touching, like this man like this, the money he used, I carry this man, the money he give me, as I don't have the sanitizer, I will start to sanitize my hand before. As I will not have sanitize my hand, I'll still use the hand again to even take the hand inside my nose and my eyes again. So corona in Nigeria or in Benue is not affecting white people like us.
Other respondents think that the distribution and management of palliatives, especially face masks, alcohol-based hand sanitizers, have not been properly managed.
So when it comes to the issue of palliative, it will be as if government knows some group of people and some group of people are not known. But if government actually want to distribute this palliative accordingly, there are ways. We have, here in Benue State, we have 3 senatorial districts. In these 3 senatorial districts, we also have wards, council wards. Here in Makurdi, we have council wards. So if government want to actually do something, like now here, this is Okada. We have, here we that are gathered here, we are Okada. We have Okada Union. In this union, we have branches. So if you want to distribute something, at these various units, you know how to get there. But now, government will carry palliatives. We just hear it on the radio. We just see it on the television that they are distributing palliatives in this so location. If you go there, you will not see anything.
From high-level market here in Makurdi, the Benin State capital, Pius Angbo for COVID-19 updates.
Well, the first generation of COVID-19 vaccines is expected to gain approval as soon as the end of 2020 or early 2021. A popular assumption is that these vaccines will provide population immunity that can reduce transmission of severe acute respiratory syndrome, coronavirus 2, and lead to a resumption of pre-COVID-19 normalcy. Well, joining us in the studio is Mrs. Mesura Adio, a clinical pharmacist, a fellow Postgraduate College of Pharmacists. Thank you for joining us on the program.
Thank you for having me.
All right, first I'd like to get your thoughts on, what we heard, the views of some Nigerians as to the non-pharmaceutical measures, talking about the discomfort of especially being out in the sun for a long time and having to wear the face mask, and also some saying that palliatives aren't really getting to them.
Well, with regards to the wearing of the face mask, we have no option but to stick with the face masks for now. Well, for now, we need to take our health into our hands. So the use of the face mask, we just need to endure for now, pending the time the vaccines will be gotten. And also the washing of hands with the alcohol-based hand sanitizers. We just need to be patient. That's just all we need to do for now. And continue using the face masks and other measures that the social distancing and some other things. At least we can now go about our daily means of livelihood for now.
Unlike
the
lockdown
period.
All right. Tell us about your optimism towards a vaccine for COVID-19, which, the world cannot wait for. And the part where if we can achieve suppression of community transmission.
Yes, basically what vaccines are meant to do is, besides preventing the infection, it also reduces the transmission rates. Well, knowing that the development of vaccine was voluntarily stopped, we should know that the people put in place necessary protocols considering safety and efficacy. Well, I'm optimistic that the vaccine will be a good development coming around. But at the same time, most of the adverse reactions that we get, like the subject that developed the adverse reactions to the vaccine, we need to put in place pharmacovigilance alert systems so that when this vaccine is fully in use now, that it's not all the reactions that happened during the study, that the reactions don't stop there. Most reactions will still come up with what you call adverse events following immunizations. So we have pharmacovigilance centers need to be on the alert, which is available. These units are available in most facilities and institutions, especially those that will be vaccinating, giving these vaccines to patients that will finally need them. And besides that, we need to also document most of these adverse reactions. But the optimism is there that it will be effective.
So we've heard from the WHO talking about the multiple COVID-19 vaccines in phase 3 trials. WHO is recommending successful vaccines should show decreased risk reduction of at least 50%, with about 95% CI that true vaccine efficacy, should exceed. Do you think that we would have that, something that that would not only confer protection, but would also reduce the spread of transmission?
Like I mentioned earlier, the objective of developing any vaccine is actually to reduce transmission to the minimal level. Well, we would. There's a possibility we would, considering safety protocols have been taken into consideration and efficacy by the companies that were developing the vaccine initially. So it's a possibility we would have that. If we don't have that, I'm sure other studies, producing the vaccine doesn't just stop there. Studies will still go on. There's what you call post-marketing surveillance. Other reactions will be seen. Other loopholes will be seen when the vaccine is finally released into the community for use. And so I'm very sure that the company would be on the alert to take into consideration most of these things and then go back to the laboratory and, where necessary, do further things that need to be done.
All right. Please stay with us. When we return, we'll be asking Mrs. Adio about the vaccine confidence amongst the general public. We'll have that and more when we return. Please stay with us. Welcome back to the program. We still have with us clinical pharmacist, Mrs. Mesura Adio. Thank you for your patience. The COVID-19 response, a number of people have talked about some politicians that have been incompatible with the science and the risk, especially with regards to the vaccine confidence. Do you think that, a lot of people are on board with regards to the vaccine, getting vaccinated for COVID-19 when it eventually comes out?
Well, I think people are. Particularly, the responsibility will lie with the National Primary Healthcare Development Agency to create a lot of awareness and enlightenment to the populace. And considering that they are the ones that will be in charge of the vaccination, they should be the ones to enlighten people. People generally, like you said on the news, some people have even have the opinion that COVID-19 doesn't really exist. But we need to keep enlightening people just to make sure that they are well informed. That's basically what we need to do.
All right. Well, I'd like to thank you so much, Mrs. Mesura Adil, Clinical Pharmacist Fellow, the Postgraduate College of Pharmacists. Thank you for joining us.
Thank you for having me.
Now, the National Center for Disease Control, NCDC, says it is set to establish sample collection centers in all the 21 local government areas of Adamawa State. This disclosure was made by the NCDC Technical Advisor Implementation Project, Dr. Fahad Mohammed, in Yola, the state capital. According to him, Adamawa State has not been testing for about 2 weeks now, which might not be unconnected to the low record of new positive cases in the state. He, however, announces the decentralization of sample collection centers to be located in strategic areas in the 21 local government areas of the state.
Our mandate is to support states in this response. We want states to take responsibility in this response. So we intend to decentralize. We intend to decentralize sample collection centers in all the 21 local governments. These sample collection centers will be located in strategic areas in these local governments. The risk communication PR will also sensitize the community in the need to test. When we start this testing, our target is to test at least 500 samples in a day in Adamawa State. In long run, we want to achieve at least 1% of the population being tested, which is about 35 to 40,000. So at the end of this intervention, NCDC will now tell Nigerians the true story of our status. But we can't really see if we are flattening or declining now, because our testing rate has declined by about 36%, and also our positivity rate too has declined by about 16%.
Now, as the Plateau State government continues to curtail community spread of COVID-19 in the state, the State Command of the Nigeria Security and Civil Defense Corps is joining forces with the government to flatten the curve with assurances of enforcing protocol guidelines across the state. The Plateau State Commandant of the Civil Defense Corps reinstates the importance of the sensitization and strict adherence to the protocols in curtailing the spread of COVID-19.
On COVID-19. It's a worldwide program. And we thank God safe. Nigeria is not like other countries that people fall on the road and die. God has blessed us in this country that we don't fall victim to COVID-19 like that. But whatever we're going to be doing now is to put in support the government in terms of social distance, in terms of this washing of hands, everything, and the nose masks. We'll make sure that people comply with all these little things so that Plateau will go down on the issue of COVID-19. So we'll just try our best by putting in place the measures that the government has already put, that's Federal Minister of Health. We will comply with them and support the government very well.
Israel made headlines last week as it became the first industrialized country to enter a second nationwide lockdown. Now the government is introducing stricter lockdown rules so as to curb the spread of COVID-19. The country on Wednesday confirmed over 6,000 cases, a high daily record.
Israel's daily cases reached the record 6,861 on Wednesday, and that has made the government announce even more stricter rules to come into force from Friday. Only essential businesses are allowed to stay open, and there will also be new restrictions on protests. The government has also decided against closing synagogues for Yom Kippur, one of the holiest days in the Jewish calendar, amid opposition from religious groups. However, services will only be able to operate under restrictive measures.
Some people are asking how we can afford to do all this.
Prime Minister Justin Trudeau says Canada has entered a second wave of the pandemic, warning that the country is on the brink of a surge if people did not follow public health guidelines. In a rare national address, Trudeau said the country was at a crossroads as a second wave emerges from 4 large provinces, adding that the government will do whatever it takes to help the country recover from the pandemic.
To take on debt that your government can better shoulder.
Some 2,500 students at Lausanne's EHL Hotel Management School in Switzerland are having to self-isolate until Monday after an outbreak thought to be linked to one or more parties. 11 positive cases have been identified, and authorities say they're too widespread to make the quarantine more targeted. And finally, the number of confirmed coronavirus deaths around the world has passed 975,000, while the global case toll stands at over 31 million. That's according to the Johns Hopkins University tally. The United States, India and Brazil are the hardest hit countries in the world.
For more updates, you can take a closer look at our website. You'll find some of the stories there on COVID-19. You can see the top story there, 111 new COVID-19 cases recorded in Nigeria last night. There's also a success story, a Mexican who was once the world's heaviest man. He has beaten coronavirus. He believes by several years of dieting, exercise, stomach reduction, surgery, he says that saw him shed hundreds of kilos. There's several other stories there. It's at channelstv.com. That's the program this afternoon. Thank you for watching. I'm Millicent Wonwoka. Stay healthy, stay safe.